There's an understandable sense of disappointment and frustration when people have already had one nose surgery and they feel like they need another due to whatever reason, for whatever reason of breathing or shape that simply isn't suiting them and isn't working for their nose. Noses are a complex structure. They're a complex three-dimensional structure. They have great beauty, and a millimetre here, a millimetre there, a little bit of downturn, a little bit of upturn makes a huge difference in noses that it doesn't make in many other areas in the face. Revision rhinoplasty is a complex operation. It requires a great degree of skill, and a person who's done many primary rhinoplasties is probably best suited to be doing revision rhinoplasties. There's complex rearrangements of structures involved in the nose, but having said that, the actual performance of revision rhinoplasty is a very satisfying part of plastic surgery practice with hugely successful results. The recovery is generally very similar to primary rhinoplasty. It's the sort of surgery that most people can be up and about, looking good, back at work usually within around about 9 to 10 days. It's a great part of plastic surgery. One of my key specialties is nasal surgery, nasal reconstruction and revision nose surgery. I have a huge practice in revision rhinoplasty surgery, and I'm often referred the most complex and difficult cases to fix up. It's just one of those aspects of noses. They are a complex three-dimensional shape. Breathing is all important, and the combination of putting those together is incredibly important. It's also incredibly rewarding to get a nose that's been previously operated on that simply isn't working for either aesthetic or appearance reasons or for breathing reasons, and transform it into almost like a work of art that works really well as well. I've had a huge training in rhinoplasty surgery, both in the ear, nose and throat part of things to make the airway good, but also in the cosmetic aspects that plastic surgeons are so traditionally good at. I've done a lot of training in the US in nasal surgery and worked with some of the top names in rhinoplasty surgery in the US with Dr. Nick DeBall, Dr. Jack Gunter, Dr. Dean Toriumi, Dr. Ron Gruber and other plastic surgeons who are premier surgeons in their field. I've learned a lot from these surgeons, and I'm training younger surgeons these days in these skills.